you state your name for me, please?
Rebecca McNeil.
Perfect, Rebecca. So I see you're here for a physical assessment for work.
Yes.
Let's get started. So unfortunately there is no sink in here, but I did wash my hands prior to entering. But just to be sure, I'll give a quick sanitization. And how are you doing today?
Good, how are you?
Great, thank you. All right. So I'm just going to start by examining your skin. If you don't mind, just tilt your head down. No lesions of any kind. Excellent. I'm just going to check your capillary refill to see when the color comes back in your fingernails. The normal is about 1 to 2 seconds, and you are within the normal range, so that's great.
Good.
So next, I'm just going to inspect your temporal area, temporomandibular joint. Can you open your mouth, please? And close, and open, and close. Perfect. Now I'm just going to check your pupils, okay? Just look straight ahead for me, please. Excellent. Okay, Rebecca, I'm going to get you to look at this curtain behind me and then focus on my pen light, okay?
Okay.
Curtain and pen light. And now I'm just going to check convergence of your eyes. Perfect. And now I'm just going to do a little test. I'm just going to cover one eye and just stay focused on any object behind me. Perfect. And another eye. And I'm just checking here for nystagmus, which would be your eye almost tilting side to side, which is not supposed to happen, and yours are not, so that's great. Okay, and now I'm just going to palpate your frontal sinuses, mandibular sinuses. Excellent. Palpate your frontal sinuses, mandibular sinuses. Excellent. Okay, I'm just going to have a look at your ears. Good. Good. Okay. Now I'm just going to get you to put your finger on this flappy cartilage. Just press it in and out. Is there any tenderness?
Nope.
Other ear, please. No tenderness?
Nope.
Perfect. Okay. I'm going to repeat 3 words in each ear, and I'm going to get you to repeat them, okay?
Okay. Basketball, soccer, hockey.
Perfect.
Monday, Friday, Thursday.
Perfect. Excellent. Okay, now I'm just going to have a look at your nose here. So it is symmetrical. Now, Rebecca, I'm going to get you to put your finger over one nostril. Breathe in. Finger over the other. And breathe in. Perfect. Okay, Rebecca, I'm just going to inspect your mouth now. If you would open up, please. Your gums look great. Your teeth, perfect. Your tonsils are normal. Would definitely say they are a grade 2, which is perfect. Can I get you to say, ah? Okay, I'm just going to see if you have a little gag reflex. Okay, Rebecca, so now we're going to inspect the neck. I'm going to check your range of motion. Can you bring your chin to your chest, please? And now, far back as you can. Perfect. And your right ear to your right shoulder. Your left ear to your left shoulder. And can you do a full circle for me? Perfect. Okay. So now I'm just going to palpate your carotid artery. Good. And I'm going to do the other side. Good. Okay, I'm just going to have a look at your trachea. Just feel a little pressure there. Good. Okay. Now, would you be able to take a drink for me and just hold it until I tell you to swallow? Put your head back a little and swallow. Great. Thank you. That. Okay, so now I'm just going to have a look at your posterior chest. Looks good. Can you breathe in? Deep breath. And breathe out. Breathe in. And breathe out. Okay. And okay, I'm just going to cross over lung fields, which I already did. I'm just going to listen for some breath sounds. Breathe in and breathe out. Breathe in and breathe out. And breathe in and breathe out. And breathe in, out. Breathe in, breathe out. Breathe in and breathe out. Excellent. Thank you, Rebecca. And I'm just going to get you to look down for me. I'm just going to make sure your spine is okay. Your spine is midline, which is exactly where it should be right now. Excellent. So now, Rebecca, I'm just going to take your respirations. So just breathe normally. Excellent, thank you. So now, when I place the stethoscope, can you please say 99?
99. 99. 99. 99. 99. 99. 99. 99.
Excellent, thank you. And actually, I'm sorry, I do have to listen a little bit more. I just have to listen to some breath sounds. Just keep breathing normally, that's great. That's perfect. Just gonna get your heart rate, okay?
Okay.
So your S1, your S2 are regular. It's perfect. I'm just gonna listen a little bit. Can you lift your arm up for me? Great. Okay, Rebecca, so now we're just going to do a little range of motion in your arms for me. Can you bring them up, down to the side? Can you flip them over? And other side? Can you bring adduction, abduction, other arm, adduction, abduction. Perfect, okay. Now I'm just going to take a couple of pulses. This will be your brachial. Now I'm going to move down here to your radial and then your ulnar pulse. Very strong pulse, excellent, okay. Nice. I'm just going to feel for your epitrocular nodes. They shouldn't be palpable. And yours are not, so that's great. Okay, Rebecca, so I'm just going to listen to some bowel sounds in each quadrant of your abdomen. Okay, I'm just going to listen to your arteries there. Excellent, okay. So I'm just going to do a light percussion. And I am going to palpate. If I'm hurting you, just let me know. Okay. Next, I'm just going to feel for your guinal area. Hopefully try and get a femoral pulse. Okay, so now I'm just going to move down to a little inspection of the legs. Okay, Okay, I'm going to just put my hand behind here to try and get a pulse. Okay, and the one on your foot. Okay, I'm just going to inspect in between your toes. Excellent, thank you. I'm just going to do a little range of motion on your legs. You can just bring your legs up, down, and then one at a time, up, and then the other. Perfect, great range of motion. So now, Rebecca, I'm going to poke you in certain areas. I want you to let me know if it's sharp or dull, okay? And just close your eyes.
Sharp. Dull. Sharp. Dull. 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 Sharp. Sharp.
Great, excellent, okay. Now, Rebecca, I'm going to need you to bring your finger to your nose. And again. And one more time. Perfect. Okay, Rebecca, so now I'm going to get you to take your heel and run it down your opposite shin. Perfect, and opposite shin. Perfect. Okay, so now I'm going to test some reflexes, okay? Excellent. I'm going to test for Babinski reflex, which hopefully you don't have. Excellent. Excellent. Perfect. Okay, Rebecca. So now I'm going to get you to stand up for me, please. Just take a couple steps forward. And then right back to me. And now I'm going to get you to walk forward on your tippy toes. And walk back on your heels. Excellent, great. You can have a seat. All right, Rebecca, so our physical assessment is done. There was no abnormal findings, which is great. I'm going to leave the room now so you can get changed, okay?
Okay, thank you.
You're welcome. Thank you.